Are you familiar with that annoying itch and mysterious red bump that often appears out of nowhere, leaving you wondering, is it a mosquito bite, a spider bite, or something else entirely? Well, you're not alone. Bug bites can be a common and unwelcome part of our outdoor experiences. Whether you're exploring the great outdoors, relaxing in your backyard, or even just sitting by an open window, bug bites can happen when you least expect them. But fear not, because in this video, we're going to unlock the secrets to identifying those pesky bug bites and, more importantly, what to do when you get one.
Perfectly evolved human blood-sucking machines, and if a couple of these get into your home, you're going to know all about it.
Ant bites. Bites from fire ants are perhaps the most repulsive of all the ant species. Fire ants sting, spin around, and then bite and cling to your flesh. The signs of fire ant stings can be a red, painful, itchy sore that resembles a beehive, a pus-filled sore that was yellow, a greater than 10-centimeter pus-filled lesion that is bloated and inflammatory. After cleaning yourself of the ants, use soap and water to clean the bite area. Moreover, you may take over-the-counter painkillers and use a cold compress. The sting will cause a sterile pustule if you are not sensitive to ants. The pustule forms over a few hours as a result of chemical substances called piperidine alkaloids found in fire ant venom. If you scratch an open pustule, it might develop infection and linger for many days. In contrast, breathing difficulties or swelling of the lips and face may occur if you have an uncommon allergy to ant bites. If that occurs, get immediate medical help or call a healthcare practitioner straight away. Bedbug bites. Insidious insects known as bedbugs conceal themselves in sofas, chairs, curtains, and yes, beds. About every 5 to 10 days, bedbugs emerge from hiding to feed. But bedbugs may survive for more than a year without nourishment. A bedbug bite may cause no reaction at all in some persons. If you get bite marks, they usually show up on your hands, neck, and face. Additionally, bite marks might exhibit the symptoms like greater than 1 centimeter red lesions, 3 lesions or more in one area, referred to as breakfast, lunch, and dinner, accompanied with swelling and itching. Usually, days or even 2 weeks pass before those markings show up, but you should get emergency medical assistance as soon as possible if you have an adverse reaction, which is uncommon. Additionally, take action to eradicate the infection. Bee stings. Although not considered a bite, bee stings are among the many assaults caused by insects. If a bee stings you, wash the affected area with soap and water right away. Next, use gauze or your fingernail to extract the stinger. If the sting hurts, using ice may also help minimize swelling. Bee stings may cause anything from little discomfort to fatality. Thus, it's critical to understand the warning signs and symptoms of an allergic response. Here are some mild symptoms that may appear after a bee sting: pain, swelling, itching, bleeding, redness, and thick, heated skin. Most mild symptoms fade away in a few days on their own. On the other hand, significant responses to bee stings happen 1 to 2 hours after the sting. Significant patches of skin around the sting often expand hours after the sting, reaching their climax 48 to 72 hours later due to significant local responses. The swelling then gradually goes away. These responses are usually not harmful. Rarely, those who have previously had severe localized responses from bee stings may get anaphylaxis from subsequent stings. After a bee sting, if you get anaphylaxis, use an EpiPen right away and go to the hospital. An allergic response to a bee sting may cause swelling, as well as other symptoms including hives, flushed skin, difficulty breathing, wheezing, and shock. Chigger bites. Chiggers are a kind of mite that like to live in lakes, woods, and fields. Chiggers may cling to your clothing and make their way to your skin when you rub up against plants that are contaminated, where they can begin eating. Chigger bite symptoms usually include hives, red sores that resemble pimples, itching or rash that appears on skin exposed to the sun. Chigger bites often occur on the legs, around the waist, or in the skin folds. Usually, the bites don't hurt. The itching, which begins within a few hours and becomes worse over the following several days, is possible with these bites. The red lumps will go away in 1 to 2 weeks, and the itching will go away in a few days. In order to get rid of any last chiggers, scrub the area with soap and water. Next, try using anti-itch cream or calamine lotion. Avoid scratching the bites since they may get infected just as you would with any bites. Flea bites. Cats and dogs detest fleas. However, fleas may also infect people. Flea bites usually appear on the legs, waist, butt, thighs, and lower abdomen, areas of skin where you wear tight clothes. Some symptoms might appear if you get flea bites: small, red sores, 3 lesions that appear next to one another, blisters, itching if you have a flea allergy. Generally speaking, fleas pose less of a health risk than a nuisance. However, they may spread typhus and the plague, which can be fatal. For example, scratching may draw germs into the skin and result in an illness. Itching and allergic responses may be managed with hydrocortisone cream or oral antihistamines, which are comparable to the medications used to treat spider and fly bites. Fly bite. Although most American flies do not carry illness, they may nonetheless bite viciously. The kind of fly may have different symptoms. For example, the jaws of horse and deer flies resemble scissor blades and will cause excruciating cuts and tears to your skin. Additionally, black flies bite viciously. The flies may cause harm if they emerge in large numbers. Rarely, sandflies may transmit the skin condition leishmaniasis. The saliva in certain flies' bites may cause allergic responses, but mostly, flies are just flying annoyances that usually result in red, puffy puncture wounds. Oral and topical antihistamines may be used to treat fly bites. Head lice bites. Due to children's propensity to slither their heads together, head lice are much more frequent in youngsters than in adults. The lice may easily move from one head to another because of their closeness. Symptoms of head lice usually include scalp itching, little red pimples on the shoulders, neck, and scalp, squeezing and seeping. Nits are white eggs that resemble dandruff. Both over-the-counter and prescription medicated shampoos may aid in their removal. Additionally, giving your hair a thorough combing and recombing aids in getting rid of the bugs. Never share anything that goes on your head, such as hats, brushes, headphones, or hair accessories, if you have head lice. Moreover, give any contaminated clothes and bedding a hot water wash. Mosquito bites. Mosquitoes have a reputation for dispersing illness. People often experience small, spherical lesions, swelling, itching, and bite marks in the center of the lesion. But mosquitoes carry a variety of illnesses, including dengue, West Nile, and malaria, and they feed on blood. For instance, mosquito bites may cause severe reactions in humans, such as hives, low-grade fever, and enlarged lymph nodes. It is also conceivable in other circumstances for a mosquito bite to cause secondary infection. The area will seem red, have a warm feeling about it, and could spread. Seek medical attention from a professional if any of those symptoms develop. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more fascinating insights into various topics. And don't forget to hit the notification bell so you never miss an update. If you have any personal bug bite stories or tips on how to deal with them, feel free to share them in the comments below. Your experiences and advice could be invaluable to others. Thanks for watching and stay bite-free and itch-free out there. See you in the next video.